Today on the Open Reduction, 5 tips to help you match into oral and maxillofacial surgery. OMFS is a highly challenging and rewarding specialty, and it's very competitive. Let me help you join us today on the Open Reduction. Welcome to the Open Reduction, your channel covering all topics oral and maxillofacial surgery. If you haven't yet, check out my channel where I have lots of oral and maxillofacial surgery cases to make sure you're actually interested in this specialty. So if you're watching this, you're thinking about going into OMFS. That's amazing. You couldn't pick a better career. But as you've probably already figured out, it's not an easy path. Most programs take 2 residents per year, and the demand for OMFS spots far outweighs the supply. It's daunting, so I put together a list of 5 tips to help you get a successful match day. First off, these 5 tips are not to get good grades, do well on your boards, rank high in your class. That's all baseline and it's obvious. Everyone applying is already there. These are 5 tips to help you stand out against other top candidates and match into the program you want. If you have any questions or there's a topic that you want me to address, please hit me up in the comments section, or you can send me an email at drbolten@theopenreduction.com. Also, keep an eye on theopenreduction.com, where I'll be posting advanced content to help you hone your oral surgery skills. Let's get to the list. Tip number 1, extern, extern, extern. So what do I mean when I say you should extern? You are signing up for an externship, which is an opportunity to visit a program, shadow the residents, and see what life is like as a resident. Externing is by far the best way to get to know a program, and it's also by far the best way for a program to get to know you. Think about it. Most OMFS interviews last a half a day at the most. You're lucky if you get 20 minutes with the program director and maybe a couple hours with the residents. You're basically signing up for a 4 to 6 year marriage on almost no time together. Externships last 1 to 2 weeks, which is so beneficial. You'll remember your extern experiences, but more importantly, they will remember you. Keep an eye on the channel where I'm putting together a video all about tips for externing. Some programs have links on their websites to sign up for externships. If not, you can call or email the program. Some don't take externs, and that's fine, but there's no harm in reaching out and asking. This brings me to tip number 2. Keep a log of every OR case you attend. Doesn't matter if you scrub the case or not, if you are in the OR, it counts. I put together a spreadsheet of every case I attended as a student and an extern. It looked like this. Patient. This isn't the patient's name, just age and gender. Example is 19M, or 19-year-old male. Diagnosis. Why is this patient having this surgery? The more specific, the better. If you write mandible fracture, you're not wrong. But if you write open displaced fracture of right parasymphysis, you'll look like an all-star. Procedure. What was the surgery performed? Again, specificity is a good thing and demonstrates that you were not only present at the case, but you have a working understanding of what was done. Same example. If you say open reduction internal fixation of right parasymphysis fracture using a transcervical approach, it's much more impressive than just saying repair of fracture. That's it. No information with patient identifiers, just a list of every case you saw. The longer the list, the better. But be honest and be prepared to discuss every case you list. This brings me to tip number 3. Prepare 1-page case reviews on 3 or 4 cases that you saw, print them, and then bring multiple copies to every interview you go on. I did this, and I can't tell you how much it helped me during the interview process. I chose 4 cases I scrubbed and then obtained preoperative and postoperative radiographs. Each case was different. One was trauma, one was pathology, one was implants, and one was denoalveolar. I printed a 1-page summary with the preoperative and postoperative radiographs, and if I was lucky, an intraoperative photo as well. I had roughly a paragraph on the case and the procedure performed, and I knew these cases cold. It can be really helpful to ask the residents to get a copy of the operative report on a case you want to present. That would be really beneficial. Remember, you always need to protect patient privacy, so no patient names, identifiable information, or medical record numbers. These cases, along with my operating room log, which I also printed and brought to every interview, did several things. They showed that I attended cases. They displayed my understanding of the case. They demonstrated that I was able to succinctly summarize a patient's treatment, which is a large part of being a resident. But the main thing they did is they directed a portion of the interview the way I wanted it to go. Instead of going through generic interview questions, we discussed cases that I knew because I prepared them. This was huge. Please take a moment to subscribe to my channel, The Open Reduction. The channel covers a wide range of topics on everything oral and maxillofacial surgery. By clicking the subscribe button, you're letting me know that you're benefiting from the content, and you're also helping the content reach more people. Tip number 4. Letters of recommendation are a necessary component of your application. And many applicants check this box by getting letters from their clinic instructors, part-time dental school faculty, and even family friends. These letters might be heartfelt, highly personalized, and glowing, but these residency programs are not looking for a ringing endorsement from someone they've never heard of. The person writing the letter is much more important than what the letter actually says. You ideally want to have a letter from the OMFS program director at your school. This is a small community, and all of the residency program directors are familiar with each other, and a letter from one of them goes a long way. This may be tough to get. You have to earn it by showing your face in the department, going to meetings, and externing. Letters from surgeons associated with the program are also great. Tip number 5. This tip will get you major points with every program director. The surgeons who are heads of programs usually are involved in research, and chances are pretty good that they've got peer-reviewed published articles. Maybe they've contributed to a chapter in a textbook. Find out. This is usually as simple as a Google search. If you're going to interview at Loma Linda, look up what the program director, Dr. Thacker, has published. It's on their website. Get the articles, read them, and go to the interviews with questions about them. This will thrill program directors who love to talk about their contributions to academia. This is another tip that will help direct the conversation in a way you want, because now you're discussing articles that you're familiar with. Thanks for watching, and best of luck. I truly hope that if oral surgery is your calling, you have great success and go on to a fantastic career in the specialty. Please click those like and subscribe buttons, and check out my channel to watch other OMFS cases, get great clinical advice, and see if this specialty is right for you. I'm Dr. Tom Bolten. I'll catch you next time on The Open Reduction.